Yes, hi everyone, good evening, and let's start this new session on the femoral triangle. Okay, so this particular YouTube session is on the topic that is the femoral triangle anatomy. Myself, Dr. Ankit Khandelwal, and I am a educator of anatomy in Unacademy Plus platform. Okay, Dr. Ankit Khandelwal, MBBS MS. This is a referral code you can use if you want to subscribe to the Unacademy Plus subscriptions. Okay. So welcome to the topic again. Topic name is femoral triangle. So today we are going to discuss about the various aspects of the femoral triangle, the anatomy of femoral triangle. So let's start with it. What is femoral triangle? Femoral triangle is what? It is a space or a depression. It's a depressive space or a depression where anatomically where in the upper medial part of the thigh, in the upper medial part of the thigh. So that location you have a slightly concave or depressed area in our body in the upper middle part of thigh where you have this area which is known as femoral triangle. Okay, so let us see where it is actually. This is the area over here. Now this I am trying to highlight over here. Good evening Sunita. I am trying to highlight stuff over here. This area in the upper middle part of the thigh, this area over here is slightly depressed. That area is known as the femoral triangle. Okay, this area is known as the femoral triangle. Now let us see what are the various things inside this femoral triangle. What are the various boundaries of the femoral triangle? So if you look at these boundaries, then one boundary is over here, which is this medial border of the sartorius muscle. So one boundary is your medial border of this sartorius muscle over here. The other boundary is the medial border of the adductor longus muscle, this over here. And the other boundary, or you can say the base or the superior boundary, is this inguinal ligament. So these are the three boundaries, and bounded by this a depressive space in the upper middle part that is known as our femoral triangle. Okay, so this triangle space of three sides. So one side is bounded by the sartorius, its middle border. One side you have the adductor longus, its middle border, and one side you have this inguinal ligament over here, inguinal ligament. Also, you can use the mnemonic over here, which is said to be SAIL, S-A-I-L, S-A-I-N-L. S for sartorius, A for adductor longus, I-L for the inguinal ligament, S-A and I-L. Okay, these form the boundaries of the femoral triangle. But here you have to note one thing, and what is that one thing? That sartorius is at the medial border. I mean the sartorius, its medial border forms the lateral boundary of the femoral triangle. It means that the sartorius muscle, as a muscle, it is lying outside the femoral triangle. So sartorius muscle is over here. Sartorius muscle is over here. This muscle is outside the femoral triangle. Its medial border forms the lateral boundary of the femoral triangle. But adductor longus, it is present inside the femoral triangle. The sartorius muscle is outside the femoral triangle. That you have to remember. Adductor longus is inside the femoral triangle. Okay, this is a femoral triangle, the boundaries. And few question, there could be question which forms a which of the following is a content of femoral triangle. Then they may give you sartorius or adductor longus. Go with adductor longus obviously. Okay, so this is lateral boundary, medial boundary by the medial border of adductor longus, and the upper superior border by the inguinal ligament. Now let us see them individually in this model specimen over here. Here if I ask you that, okay, identify where do you think would be our femoral triangle, then this is the area. This is the area of the femoral triangle. Let me just put it with this pen over here. Yes, over here. This is your femoral triangle over here. This whole is the femoral triangle. Okay, you can see this middle boundary of the sartorius, adductor longus, and the inguinal ligament over here. Okay, this is our femoral triangle. Now if you look at the muscles over here, muscles, just to point out a couple of them, this one was SAR dot, and that one was the adductor longus. This is obviously our inguinal ligament. Now I told you that this space, this dotted space, that is a femoral triangle. It is a depressed space. So if we want to look at the what is the depression over here, then this figure is going to help you. Just looking at the more superior, or you can say the anterior superior view, then you can see this space over here. That was our sartorius muscle. This was our adductor longus over here, adductor longus, and this was our femoral triangle. So this was our femoral triangle. You can say that this space over here, this dotted area, that is space, that is our femoral triangle. So you can see that these muscles over here, I'm putting arrows, they are forming the floor of the femoral triangle, and this space which is being empty, which is dots over here, they are actually the content. They would be the, you know, the, what we say, the room of the femoral triangle, or where you will have the contents. So in this area you have the contents of femoral triangle, while these muscles, they form the floor of femoral triangle. So what are these muscles which are forming the floor? One is your adductor longus, already specified over here, adductor longus. The other one over here, just lateral to it, is your pectineus, and these one which is coming from the upper, that is the lumbar transverse process. This is your psoas major over here, and it mixes with the iliacus. It mixes with the iliacus. So you have these muscles. I'm just writing adductor longus one more time. So these muscles, they form the floor. From medial to lateral, you have adductor longus, pectineus, iliacus, and the psoas. This is known as iliopsoas. This is known as iliopsoas over here. So they mix with each other. They are forming the muscles of the floor of femoral triangle. So that was all about the boundaries and what muscles are forming the floor. I repeat again the boundaries: sartorius, sail. Boundaries, you may remember it by the sail, and the floor, if you want to remember from medial to lateral, you can use this APPI: adductor longus, pectineus, psoas, and the iliacus. Psoas is psoas major over here. Because medial to lateral is these muscles forming the floor. Okay, I see this image is particularly to tell you, or to show you, that what is this concavity, this depressed space. So where this space is this over here, the dotted area. Okay, now is cadaveric time for cadaveric images, and let us see the cadaveric images what we have just learned. Identify this muscle, the longest muscle, that is obviously our sartorius. So we will make its medial border over here. The males make its medial border. Okay, this muscle over here, that is our adductor longus. So now you have medial border of adductor longus. This is again a floor, pectineus. This is your psoas major over here, and that is our iliacus over here. You can see there's APPI forming the floor, medial border of adductor longus, and then you have this as the inguinal ligament. They all are forming the floor and all. This is your femoral triangle. I guess the boundaries and the floor, that thing is should be now clear. Another thing comes is that if we look at this image, that is showing you mainly the contents. This is a cadaveric image showing the contents. So now what are the major contents? So before going to that image in detail, let us first understand that what would be the contents that we would see in the femoral triangle, because the main objective is why we are reading the femoral triangle. We are reading the femoral triangle not to just learn its boundaries and the floor, but what are its contents, what is the applied part. So contents of it are, that is another mnemonic we can use as a navel, NAVEL. NAVEL from lateral to medial. This is from lateral to medial if you go in the content part between the floor and the sartorius, the space. N is for the nerve, that is the femoral nerve over here. A is for the artery, again the femoral artery over here. V is for the vein, that is the femoral vein over here. Okay, femoral vein. Now this is your L is for the lymphatics, that is for the lymphatics. So lateral, or again the medial to the femoral vein, you have this E for the empty space which has the lymphatics. So that is E for empty, L for lymphatics. Now let us see over here in this particular diagram what we are actually trying to tell over here. This is the area for the inguinal ligament, that is your sartorius already shown. Its medial border is running like this. Over here. Yes or no? Is the left side femoral triangle. This is your adductor longus, so its medial border is running like this over here. This will be the medial border of adductor longus. Let us use this color so that it is better visualized. Okay, and this is a femoral triangle. Now lateral to medial, the contents are NAVEL. So just let us see those contents also. N for the femoral nerve, A for the femoral artery, more medially V for the femoral vein, and then you have this empty space which has a few lymphatics. Already lymphatics would be not better seen in the cadaveric in the dissection and all. So this space is the empty space which has the lymphatics. Okay, now you have to remember one more thing, and that is also very important, that these structures, femoral nerve, artery and vein, they are coming from the above, or they are coming from below and going above, entering into the abdomen, or coming from the abdomen part. So they are covered by a sheath over here, which is known as the femoral sheath. They are covered by a sheath over here. Okay, so these structures are covered by a sheath, and that sheath is known as femoral sheath. Femoral sheath, another very important question that usually come from femoral sheath. It is a double layered, You will have an anterior layer and you will have a posterior layer. If you can remember, anterior layer of the femoral sheath is by which fascia, and if you can remember, the posterior layer of the femoral sheath is by which fascia, that would be great. Remember, the femoral nerve is outside the femoral sheath. Femoral nerve lies outside the femoral sheath. It is not inside the femoral sheath. But yes, artery, vein and lymphatics, they will be lying inside the femoral sheath. Femoral sheath anterior layer is formed by what? Femoral sheath anterior layer is formed by your fascia transversalis. Fascia transversalis. And the posterior layer of the femoral sheath is formed by the fascia iliaca. Fascia iliaca. These two fascias, they form the anterior posterior layer of the femoral sheath. Okay, femoral nerve lies outside. Let me make this nerve over here. Femoral nerve lies outside. There is also one more nerve which will go along with the femoral artery, and the name of that nerve is your femoral branch of genitofemoral nerve. So along with the femoral artery, what else we have? We have the femoral branch of the genitofemoral nerve. So if this is a femoral sheath over here, suppose this is the femoral sheath over here. Okay, femoral sheath, it runs for around 4 to 5 centimeter. That is the lateral side, that is the medial side. So femoral sheath itself has 3 compartments. Most laterally you have this femoral artery, this coming down. Medial to it, what we have this femoral vein that is coming down. And most medially what we have this lymphatics, and sometimes there could be a lymph node, which will be a deep inguinal lymph node over here. This is the lymphatics. This whole medial compartment having the empty, that is known as your femoral canal. That is known as the femoral canal over here. Okay, this is your femoral artery, vein and the femoral canal. Along with the femoral artery, we just discussed that yes, there runs a small nerve over here, which is a femoral branch of genitofemoral. Now what is its function? It is cutaneous to the skin over the femoral triangle. Somehow it forms the afferent part of the cremasteric reflex. This nerve forms the afferent limb of the cremasteric reflex, if you remember that cremasteric reflex. Okay, this is the basic anatomy, that what are the structures over here. Lying over here. Let us see another image. Yeah, this is separately showing you all the structures. Beautiful images from the models. They're separately showing you all the images over here. You can see separately the femoral artery, femoral vein. Femoral artery location is just beneath the mid-inguinal point. That is also a question that is asked. It's a continuation of the external iliac artery from here. From here you have the external iliac artery, so it's just a continuation from the external iliac artery at the mid-inguinal point. What do we mean by mid-inguinal point? Between the ASIS and the pubic tubercle, we have this running down as the inguinal ligament. Mid-inguinal point is beneath it, or you can say between the pubic symphysis and the ASIS, the midpoint. Okay, that is actually the mid-inguinal point between the ASIS and the pubic symphysis and its midpoint. So external iliac artery continues as the femoral artery, and this femoral vein medial to it will continue as the external iliac vein. It continues as the, let me write over here, the external iliac vein. Okay, all these are the branches of the femoral artery. One branch I need to mention over here, which is worth noting, and that is this branch which comes out posterior laterally, that is your profunda femoris artery. This is your profunda femoris artery over here, also known as the deep femoral artery. Okay, just to show you. So artery is lateral and vein is medial. Now various uses. This femoral artery, clinical use, can be used for the palpation, because it is behind the this bony part, that is the hip joint. It's just in front of the hip joint, so you can easily palpate over it. It is also used in cardiology for if you have to reach the descending aorta or the thoracic aorta, if you reach the arch of aorta, if you have to do any surgeries on the aortic valve, then you can go through the femoral artery. Even for the angiographies, for the angioplasties, you can go from the femoral artery. Femoral vein is also giving access to the great veins like your external iliac vein, then common iliac, then the whole IVC. So it is also giving you the vein drainage over here. At times when you need to take out the blood for the femoral tapping, then you need to take out blood from the veins of the body and the other veins which are collapsed. So here you can easily palpate the femoral artery, and just medial to it you do femoral tapping. You insert the needle down perpendicularly and take out the blood from the femoral vein. That is known as femoral tapping. So this anatomy is very important. You need to know that what lies from lateral to medial. Lateral is the femoral artery, medial to it is the femoral vein, and more lateral to the artery, that is outside the sheath, will be the femoral nerve, will be the femoral, that is outside the sheath. So this is basic anatomy over here. This point is very important. Let us see the other image also. These are for the nerves. So in this particular slide, only the nerves are shown. What is being shown over here is the right femoral nerve. Right femoral nerve, you can very well see it is coming from the lumbar plexus. So these are your L2, L3 and L4 over here. That would be L5, this would be S1. So the root value is L2, L3, L4. You can see this bright yellow color over here. That is representing the right side femoral nerve. And you can see it is going down right over anterior to the hip joint, just lateral to the femoral artery. So if we can make over here, the femoral artery would be lying somewhat around. It's a big artery. Femoral artery is not a small, it's a big artery, would lying somewhere over here. So femoral nerve lies lateral to the femoral artery. Now there could be another question, that the femoral nerve lies where? Femoral nerve lies as it travels where? It travels in the iliopsoas groove. So you have this iliacus muscle over here, this psoas muscle coming from here. It travels in the iliopsoas groove, that is between the iliacus and the psoas muscle. The femoral nerve will be traveling. That is the femoral nerve. But here we can see all the plexus. Let us see the other nerve also. This is your obturator nerve. Can you see the bright yellow color over here? I hope you can see it. You can see this obturator nerve having the same root value, but this was our femoral nerve, and this one medially through over here. This over here is our obturator nerve. You can see it is passing through this obturator canal over here, going medially, because it supplies the muscles of the medial thigh, muscles of the medial compartment of the thigh. Okay, so root value is same. Obturator nerve is probably coming from the ventral division or anterior division of the ventral rami of L2, 3, 4. Femoral nerve is coming from the posterior division, obviously, of the ventral rami of L2, 3, 4. So you can see both of these nerves, how they are passing. And the most important nerve over here is your sciatic. The most important means not the most important, but the biggest and thickest. This is the thickest nerve over here. You can see its root value L4, 5, S1, S2, S3 is coming from inside also. You can see this is your bright color is showing you the sciatic nerve. Where it is passing? It is passing through a gap over here. This gap is what? This gap is what? Yes, Akshay, very good. This gap is known as the greater sciatic foramen. Okay, this is gluteal, that is greater sciatic foramen. Okay, this gap is known as the greater sciatic foramen. In anatomy also, as Akshay told us, in cadavers for fluid infusion, for embalming the cadaver, we normally use the femoral artery also. We can use the carotid also, but femoral artery is also effectively used. You will see, if you remember in the first year when you go to the dissection halls, when you have a cadaver on your dissecting table, there is some knot and there is some small dissection being done on the groin part of that particular cadaver. When you reach the lower limb part to dissect, you see that okay, already it has been slightly dissected in the femoral triangle. That is what is from femoral artery. We give around 8 to 10 liters of the embalming fluid for the cadaver, and it's for the embalming of the cadaver. Clear? So this is your sciatic nerve. You can see sciatic nerve. It is related what it is related posterior to the hip joint. So it is also involved in the hip dislocations, posterior dislocation of the hip. It is frequently involved. Okay. So we have seen the boundaries. We have seen what is space it is forming. What are the muscles in the floor. We have seen the contents. We have talked a little about the femoral sheath, having the femoral artery, vein, femoral branch of genitofemoral nerve, and your femoral canal. Now, what are the various applied aspects of this? Okay, but before this, we go to this particular picture. This is, you are looking at a superior view. It is showing you the lymphatics and the lymph nodes. This picture is showing you the lymphatics and the lymph nodes. So now, what is important over here that you need to understand is that these are your bunch of the superficial inguinal group of lymph nodes. They are not that important, but they are important, but not right over here in the femoral triangle. This located more medially, more inside, that is your lymph node of Cloquet, or lymph node of Rosenmuller. That is a deep inguinal group of lymph node which is present in the femoral canal. This is the lymph node which is present in the femoral canal, which was lying more medially. So here you can yourself imagine that the femoral vein would be somehow located over here, and lateral to it you have somewhat over here, you have the location of the femoral artery going down. This is a superior view. You can see the sacrum over here, you can see this pubic bone over here, this lymph node over here this particular lymph node was your lymph node of Cloquet, that is a deep inguinal group of lymph node. Are the point is clear? If you recognize, yes. Good evening, Shubham. Okay. Now let us move forward to see how they appear. So this is a particular picture showing you that how are the structures which are inside and outside. So this dotted area is showing you the fascia transversalis anteriorly, and also you have the fascia iliaca posteriorly, and between this you can see the artery, vein and canal are inside it, while the nerve is outside. This is the femoral nerve that is outside the femoral sheath. Now let us all understand, okay, what could be the various applied aspect of the femoral triangle. Why we are reading it from the last 10-15 minutes, this femoral triangle. Applied aspect could be a swelling in this femoral triangle area. Now you should know where is the area: upper middle part of the thigh, sartorius, inguinal ligament and the adductor. That region is the femoral triangle. If there is any swelling over there, what could be the differential diagnosis? So you can only arrive at the differential diagnosis once you know what are the contents over there. So yes, what could be the DDA, the swelling in the femoral triangle? So let us look at the femoral triangle. Let us reach that image in the femoral triangle, and then let us try to find out, yes, over here. If there is a swelling in this femoral triangle, what you can think of? Yes, any swelling in the femoral triangle. There could be a problem with the skin to start with. There could be a problem with the skin. Any pathology of the skin, that could be over there. Then there could be problem of the fat part in the superficial fascia. There would be disease in the skin or superficial fascia part. Okay. If not, then we go a little bit deeper. What were the contents? There was an artery. There could be aneurysm of the femoral artery. Yes or no? There could be an aneurysm. There was a vein. There could be, saphenofemoral junction. There's your varicosities, because the great saphenous vein, it enters from the medial side, enters into the femoral vein. So there are high chances of varicosity. So there could be varicosities over here, also known as varix, saphenous varix. Okay, these are all the DDs. What are the other content? There was a nerve. There could be a neuroma over there. This is what I'm telling you. If you know the anatomical contents, how you can come out with a different diagnosis. There was a very important femoral canal, due to which from where the femoral hernia may come down. I'll show you a figure. Femoral canal was empty space. So from the abdomen inside, the small intestine or its peritoneum or omentum may come down through the femoral canal. That is known as femoral hernia. Though it is not common, but it forms around 2 to 4% of the inguinal hernias, or you can say hernias around the groin region. More common in females. So DD was femoral. There's from the femoral canal we have a DD. Then you have the lymph nodes. There could be some any lymph, what is the lymphadenitis or lymphangitis. There could be problems in the lymph node, pathologies in the lymph node. Are you getting a point? There is muscle. Normally muscle pathologies are rare, but yes, as the psoas, iliopsoas is coming, there could be a psoas abscess that could drain down. Behind there's a hip joint. There could be any joint effusions that could be there. So just look at the content from skin outside, skin, fascia. You had the nerve neuromas. Any nerve could be involved over there. Then you have the artery problem, you have the vein problem, you have the canal problem, you have the lymph node problem. You can have the this psoas abscess through this sheath covering the psoas major muscle. You can have the joint effusions. You can have even the bones also. There's again the bone tumor also in the upper end of the femur, that could also present as swelling. So just by knowing the anatomy, you can very well come out with a DD of a swelling in the femoral triangle region. That was my point, to tell you our small knowledge of anatomy can help you reach out to some DD of the swelling in the femoral triangle region. Okay, thus you have seen all the contents. Now here was this image we already seen. This is the femoral canal over here. That is the femoral canal over here, as already seen. Now I told you that, okay, some things from the abdomen may come down, cause a femoral hernia. Now femoral hernia, if it comes down, then this was our, say, femoral canal, the empty space having lymphatics and a lymph node Cloquet. The upper end of the femoral canal is known as the femoral ring. Now that is a totally different topic, but yes, that is important. Femoral ring is actually covered over here by the septum, that is known as femoral septum. Now if there is any increased pressure from the abdomen, like over here, you can see the femoral fossa over here that could go through the femoral septum in this direction. So I'm just highlighting it over here. That could go down over here, okay, in this direction, and that could go through the femoral septum. It would come in the femoral canal. Now from the femoral canal, it will first move anteriorly, and then here there are a lot of femoral vessels, branches. So from that it could actually be traced with the branch of any femoral vessel. So it forms somewhat U-shaped structure, or it's projecting anteriorly. More prolonged, it may project upward also, as it goes with the superficial epigastric vessels or superficial circumflex iliac vessel. So it follows that path. Why it is not going straight away down? Because this is a deep fascia, which is a very tough fascia. So you may think, okay, why it is not going down? Because you have this is a deep tough fascia, fascia lata, which is present lower down. So it won't go over here. It will enter into it, but then it will enter into this femoral canal, but then it is confused where to go, and it traces, because these vessels, their branches, they form some path, so they will go along with it. So that also becomes a DD, meaning by, say, this is our inguinal ligament, that is our pubic tubercle, that is our ASIS. Now if the neck of the sac is below and lateral to the pubic tubercle, right over here, you can think of femoral hernia. But the neck of the sac is above to it or medial to it, here you have all the inguinal canal, and here you can have the direct hernias, as well as from here you can have the indirect inguinal hernias. So the landmark becomes your pubic tubercle. Below this pubic tubercle, if you have a neck of the sac, think of femoral hernia, particularly more in case of females, much more than males. But this only forms a 2 to 4% of the hernias over here. Majority are these inguinal hernias. Majority are these indirect or direct inguinal hernias. In that also, more commonly it is the indirect one. More commonly it is the indirect one, more than direct, more than femoral hernia. But here, as we are discussing the femoral triangle, therefore we need to talk something about the femoral hernia. Okay, so this was what we tried to discuss, the topic, the anatomy of the femoral triangle in some time, boundaries, contents, and what are the relevance of that contents, femoral hernia, all the details of this swelling. Okay, so that's all from my side. I hope you guys enjoyed the session. So keep on enjoying the session. For more of any content, any topic you need, just message me up. Okay, that's all guys. Myself Dr. Ankit Khandelwal. I am educator of anatomy in Unacademy Plus platform. Okay, so bye bye and stay safe.